Welcome back to Behind IVF Clinic Doors. I'm Thelma, your patient advocate. If you like what I do, share this video, leave a like and a comment. It helps the channel grow and helps patients find the right clinic. Today, I'm in Tbilisi visiting one of the most international IVF and surrogacy clinics in South Caucasus. LeaderMed. Georgia is one of the few countries with legal commercial surrogacy and clear recognition for intended parents. And for LeaderMed, surrogacy isn't a side service. It's at the very core of what they do. With 25 years of experience, they guide intended parents through every step. And here we are in the northwestern Tbilisi, the Digomi district, a rapidly growing modern residential suburb known for its family-friendly community.
Hello, hi, I'm here for my first consultation.
Okay. Do you have a question?
Yes, sure.
First step, checking in for my consultation. You just need your passport or ID and to sign a consent form. You can tell this clinic things about its patients: coffee, vending machines, a pharmacy, multilingual signs and stuff. And now let me introduce you to my patient coordinator. With patients flying in from every continent, this role is about far more than logistic. It's about trust.
First of all, thank you for your interest. So, as we have discussed in advance, we are planning to undergo IVF treatment using with your own eggs and surrogacy. So, here is your package. Please review and ask me any questions if anything is unclear for you. Okay, here is your contract. Please review it carefully and sign if everything is clear. Here are several options. If everything is clear for you, it's time for your appointment with doctor. Let's go and meet her.
Okay, perfect. Let's go.
Next, let's meet Dr. Barbakadze, the doctor following my case and the person who will be guiding every medical decision from this first consultation all the way through treatment.
Hello. Hello, nice to meet you.
Nice to meet you as well.
To meet you. Yes, okay, I'm Dr. Ludmila Barbakadze, obstetrician, gynecologist, and reproductologist, over 15 years of experience in this field. So on our first, most of our patients, they come here for infertility. Also, we provide another services, another gynecological services. Here is the day of the menstrual cycle and the day of stimulation. On the first visit, when we start stimulation, we give patients for 5 or 6 days injections. So here is written day 1, 2, 3, 4, 5, and here is, you see, the medication and the units of that. Here is, for example, Gonal F and Meriofer.
In this first consultation, Dr. Barbakadze explains the entire process, and together we discuss the best option for me from the wide range of treatments LeaderMed has to offer. She also walks me through the blood tests I'll need to do and the ultrasound I'm about to have. This fertility ultrasound helps visualize my uterus, my ovaries, and fallopian tubes, checking everything is ready for treatment and a future pregnancy. It's a simple scan but a crucial one. It can reveal things like fibroids, cysts, and the kind of findings that shape which treatment is actually right for you. And this is one of LeaderMed's operating theaters and recovery areas, because yes, they have more than one. This one is reserved for more complex surgeries, the kind of procedures many fertility clinics would have to refer elsewhere. Later, when we visit the lab, you'll see the second operating room right next to it, where egg collections and embryo transfers take place. This calm, low-light room is the sperm collection room, private, quiet, and designed to put patients at ease. And just after it, where all the action happens, the Embryology Lab. Remember the second operating room I mentioned? It's right next door, so eggs go from collection to the lab within seconds.
Those are two post and pre-operational wards for the patients. a company person, of course, is allowed to enter and see the partner, not before but after. This is the Embryology Lab, operational theater. OPUs and embryo transfers we perform here. No one has access to the embryology, and welcome.
Thank you.
So this is our embryology, our junior embryologist, senior embryologist, Maya, the author of First Baby, IVF test tube baby, 25 years ago. And let me show you this unique, very, very old, but very amazing station, Narishige. Here she used to perform this amazing ICSI procedure. Benchtop incubators, the newest Narishige Takanome 2 ICSI stations with laser. This is another benchtop, laminar from case system, and the newest 2026 ESCO workstation and incubator as well. This is another part, andrology, sperm preparation and semen analysis we are performing here. Of course, the appropriate person is dealing with the sperm samples. Also, cryopreservation, sperm freezing is performed here. Also, PRP, platelet-rich plasma procedure, also is performed here. Actually, this is also very interesting machine. It's incubator and same time monitor, and we can move it whenever we would like to move. For example, embryo transfer, yes, or PRP. So we can put embryos here and we can move it whenever we would like to move, okay? This is cryo storage room, very interesting room. I love it because here in our containers, dewars, here we keep all the embryos.
Next, a quick visit to the Diagnostic Lab, where your blood and other samples are analyzed. Having it all in the same building means faster results and a smoother experience for patients who travel a long way to be here. And then something special. We get the chance to meet the person who made all of this possible, the founder and Dr. Natalia. 25 years ago, she started what would become LeaderMed, and today she's still at the heart of everything this clinic does.
Yes, we're talking now about our internal protocols regarding, of course, in vitro fertilization and donation surrogacy in our hospital. Yes, it was very amazing period in our life. It was, that 2000 years, the first baby was born in not only in Georgia, but in all Caucasus Republic, and it was so interesting period in our life of our group. And after that, we moved to another hospital. It was our private in vitro clinic. It was very famous clinic that period. And now we have multifunctional hospital, yes. But the main basic department is, of course, in vitro fertilization and donation surrogacy as well. Yes, we did it. It was the first baby by our group.
It is a process that, when you think about it, still makes you emotional, right?
Yes, it was very emotional. That time we were in USSR, and it was very difficult to do some additional procedures because we have no connections, we have no supply, we have no internet that time. Really, it was difficult, but we did it, and we are proud of it.
Yeah, really amazing.
Yes. And our group now is in LeaderMed clinic. Yes, all group, including doctors and embryologists. The first embryologist in Georgia, Maya Koyama.
Who performed.
And the second is Laliko.
And we have seen in our lab this unique machine, Narishige, that. So with that machine was created your first test tube baby, and goosebumps on my skin really whenever I am thinking about it.
Perfect.
And that was LeaderMed. 25 years of experience, the most international patient base of any of the clinics I've shown you so far. But what's so distinctive about LeaderMed isn't the volume, or the legal surrogacy framework, or the donor screening for 2,000 conditions. Although, of course, that's obviously important. It's what sits underneath them. The public position in surrogacy is one of the most explicit I've seen anywhere. Protect the surrogate first. Her health, her dignity, her autonomy, her rights. Ethical surrogacy, in their own words, only works when medical excellence is paired with transparency, legal protection, and continuous support. In an industry where the surrogate's voice has historically been the one most missing in the brochure, that's a real ethical stance. If you ever consider surrogacy abroad and wonder who in the system is actually looking for the surrogate, give LeaderMed a call and ask them, how is the surrogate treated when a cycle fails and not when it succeeds? And listen to what they say. Now, comment below. Tell me one thing you wish more clinics did in terms of surrogacy, whether you're considering becoming a parent through this way or considering being a surrogate, or just thinking about the whole question. Let me know. I want to hear from you. And I'll see you in the next episode. Take care. Bye-bye.